former President John Mahama has cancelled his Speakout Tour across the country in response to the ban on public gatherings by government. He said it is time for the nation to unite and fight the common enemy, disclosing that his former appointees, who are knowledgeable about dealing with Ebola, are also willing to work with the Kufuor administration on the coronavirus pandemic.
And all see the evidence from other countries, China, Iran, Italy, Spain and others, about how significant it is. It's a global pandemic, and experts say it is likely to infect very large. Most will only suffer mild symptoms, but sadly the virus is especially dangerous for the elderly and those with existing health problems. As a response to the threat, acknowledge the challenge faced by all those in charge of our public health who have to take on the responsibility of dealing with this crisis appropriately. Include limiting travel, cancelling public gatherings, enhance hygiene procedures, the use of hand sanitizers, soap and running water, and following the prescribed social distancing measures. This advice and to lead by example, I have temporarily suspended my Speakout Tour across the country while we review procedures and put in place measures to minimize any risk of transmission during this period. We will keep the regions updated on any new developments. The virus outbreak is a national issue, and we really are all in this together. My party and I will play our role in supporting national efforts to mitigate the threats and to support our people through this crisis. But let's face the facts. Our public health care sector is already under strain, and the coming weeks and months are going to be challenging. I call on the government to make every necessary investment now to support their efforts. We need to ensure a supply of medical equipment, such as ventilators for treatment of the vulnerable, and most especially protective. We need a plan for the testing of the many thousands of people who will be turning to the healthcare system for help. I call on the government to publish a comprehensive plan on how it intends to deal with this emergency around the country. Furthermore, I give my word to the people of Ghana that as a minority and the voice of the voiceless, we will hold the government to account on these issues. We will be supportive of the measures and actions being taken by government, while remaining vigilant in ensuring that the public is adequately protected. This is not a time for words. It is a time for action. What the government did not address is the wide-reaching economic impact of the pandemic. We've seen governments around the world make bold moves to protect their economies, and we should expect the government of Ghana to respond rapidly to this challenge. I therefore call on government to publish its plans to protect the economy, including the possibility of a statement to Parliament on the expected impact on our economy of the disruptions of COVID-19 on global supply chains and international travel. A comprehensive budget review to Parliament may be necessary subsequently. The virus is not only an Accra or Tema problem, as we have noticed. One of the cases was found in Obuasi. Government must therefore immediately ensure the provision of isolation centers in all regions of the country. An identified case kilometers from Accra must not be transported to Accra for isolation and/or treatment. The availability of regional isolation centers, together with adequate testing kits and more than enough PPEs, protective equipment, will be an encouragement to our medical personnel currently sacrificing a lot to support the ongoing efforts. We must also provide adequate assurance to our frontline health workers of their protection. An insurance package for health workers who may become severely infected in the line of duty will be a good start. During the Ebola crisis, I had the experience in working with our partners in ECOWAS and the UN in addressing the threat. ECOWAS must now put in place common enforceable protocols to deal with the coronavirus across the sub-region and related issues. ECOWAS Health and other relevant ministers and their advisors must hold a teleconference as a matter of urgency to review sub-regional actions that are being put in place to protect us. I commend to the government the lessons of our years ago. Misinformation and mistrust are our enemies in this fight. A pandemic of fear can only be prevented if the relevant authorities prove themselves to be transparent and trustworthy by
That's former President John Mahama there speaking about ventilators, PPEs for frontliners and calling for inclusion of those who have experience from dealing with Ebola.